Senator, I know that there are the Democratic approaches, the Republican approaches, but from your side of the aisle, to what degree is Minnesota's answers for our problems linked to the federal health plan?
Well, Minnesota had a very, very good system. We had the Minnesota Comprehensive Health Care Association that took care of the high-risk pool, subsidized by the people of Minnesota, structured very well, worked very well. Looks like the feds are going to go that route as well as one of their reform, to repeal and replace one of their reforms, modeling after Minnesota. So I think that there are, when Obamacare came in, Minnesota, all these things that we had in place were just dramatically either made unable to be functioning. The other thing is the whole MNsure, hundreds of millions of dollars spent on software that is really not working. Lots of money. There are issues with that. There are just numerous ones that it's really sad to see. Minnesota was very proactive, very diligent, very compassionate, did a lot of good things. And then with one stroke from Washington, wiped all of that out and just put us in a very serious position. But, you know, we'll work together. So Senate File 1 did a lot of good things. We're going to continue to do some more. In addition, we did federal tax conformity. We did that. It was $21 million of relief for Minnesotans. But the big thing is we got it done before tax season started. So all the accountants who have emailed and said, thank you for getting it done while we are doing the income tax of Minnesotans, so it's built into the software and different programs that they use. That's really a good thing. So that was a great start. We passed the Rural Financing Authority, a loan program for rural Minnesota in particular that enables them to get low-cost loans, and it's a revolving fund. They pay them back, has a 1% default rate. So it's a very solid program.
This is directed at small businesses or co-ops?
Farmers. Farmers in particular. And the young farmers these days, because of the estate taxes, which are so high, many times when they inherit a farm, they have to sell a piece of the farm in order to afford to keep the rest of the farm. That makes it very hard to have the size that they need to make farming work for them to be successful. With these loans, it helps especially young farmers get a start in the business, not have to sell a piece of the farm, and able to make a go of it in a small farm.
For many farmers today, perhaps most, 240 acres just won't do it unless you are a niche farmer. And there are those who do it very well. Just a reminder to our audience that you are joining us tonight, as many of you do on Thursday nights, for Your Legislators. Tonight we are speaking with our legislator of the moment, Senator Mary Kiffmeyer from Big Lake.
I'm certainly hoping. I so miss my colleagues being here. There's such a wonderful dynamic when you have Democrats and Republicans and we all
we
comment.
like that.
And it just feels like we're missing.
Well,
I hope maybe some
we
of
are.
you
So,
can come.
No, I'll still be the moderator.
Okay.
We'll have to wait for the others to join us.
Okay.
But we do have, we understand the House ran into a late session, and we're hopeful that they'll join us shortly and be with us for the balance of the program. And again, a reminder to our viewers, join us with your questions via Twitter, via the telephone, get online, and send your questions to us. We'll bring them along at this moment and for the foreseeable minutes to share them with Senator Mary Kiffmeyer. One of the questions that did come in, and this goes over to perhaps somebody who would be on the other side of the aisle, I'm going to presume, but the question comes from Todd County, I believe. Why can't the legislature come to an agreement to have a single-payer health insurance plan? And then he goes on to cite certain what he believes to be or she believes to be shortcomings in our system today. But that's a great big global picture, single payer versus what we do now. I don't detect a lot of sentiment in the majority party in Minnesota House and Senate to move that way.
Absolutely not. We believe that here in our country, the freedom that we have and the quality of care that we have is greatly benefited from an open market, not government dictated, government run, and all that comes with it. And so we believe, though, that our current healthcare system was very much disrupted by an effort to do a very heavy-handed government approach that didn't work. So getting more government in, I don't think that advances the needs of Minnesotans' health care by going in that direction anymore. And so we're going to give our approach to it an opportunity to succeed and to work, working with the governor and working with input as well from everybody that is willing to help and assist in that regard. But as we've done already with Senate File 1, have implemented some of them, signed by the governor, a Democrat. So I think we're making progress in that
There is some
regard.
bipartisanship as we go through this session thus far.
Way more than you know, because sometimes the bipartisanship effort we do doesn't make the news. The disagreements do.
Oh, yeah, headlines, as a matter of fact, right?